name is Dr. William Kedia. I'm one of the founders of the company and the chief medical officer. So I'm a primary care physician, family practice. I've been in practice for almost 20 years in the Cleveland area. My offices are located in Summit County near Akron. And how I got into this whole business or industry, I started looking at this about 5 or 6 years ago when it was available in Colorado from a medical perspective. And looking at research, looking at data, both coming out of the United States, the little that there is, then that piqued my interest, and I started looking in European data, Canadian data, and that really, as more people started using it, as more research came out, and we saw the efficacy, especially in chronic pain, that's when I really started turning my attention and my focus to potentially getting into this industry in some way, shape, or form here in the state. It's a big leap of faith. I will not argue that point at all, but I don't feel uncomfortable about this anymore. I think the tide has shifted, and I really think that legalization is on the horizon and on the near horizon. It's just a question of time, not a question of if. So when you look at cannabis, there are two main cultivars, Indica and Sativa, and they both have different uses. They have both different THC content and CBD content. Genetics has come a long way in cannabis. We can now tweak at the manufacturing level. You can actually tweak the content based on how you hybridize the two strains or the two cultivars. So you have, if you look at any of the products, you'll see hybrid, indica, sativa. So those are the three main classifications. And you can alter the content of the finished plant material, the actual consumable, by altering how you crossbreed and how you pollinate and how you tweak the genetic recipe, so to speak, of that plant. Varying levels of THC will provide, for your depressed patient, you may want a little more of a euphoric effect to get them out of that depression. So you may want a higher THC content versus that CBD content. So let's say that's strain A. Strain B, you may want more CBD and less THC to treat things like arthritis. So you can customize and you can tweak all of those concentrations. So there's a variety of ways of achieving that goal. Let's talk about chronic pain, because that's the #1 driver for medical use in the state, right? So how does it work? It binds to pain receptors, and it actually inhibits impulses or signals to those pain receptors so that patients don't experience the same level of pain. It also binds, you actually have cannabinoid receptors in your brain. So it's not just from cannabis that you have those that medication binds to those receptors. There are other things in nature and other medications that actually utilize those receptors, and we're now slowly finding out about that with the advent of increased research. So when the THC binds to these cannabinoid receptors, they actually dull pain. Pain impulses aren't felt as strongly. So from that perspective, it is extremely beneficial. So what glaucoma is, it's an increased pressure of fluid or collection of fluid in the intraocular space that affects vision and in some instances can cause blindness. Cannabinoid receptors there as well help mitigate some of that fluid collection so you don't have those increased pressures. Amyotrophic lateral sclerosis, ALS. It'll help in ALS as well. Again, the main benefit in ALS is pain as well as mood. It'll help with that as well. So PTSD, very difficult to treat with our current medications. I actually see quite a few military patients, active duty, reservists, retired. We have actually a significant population. Being where our patients are located, we have a National Guard reservist outpost in Ravenna and also in the Stowe area. So I see a lot of military. And quite a few of them, especially the active duty and retired, suffer from PTSD. It's very difficult to treat PTSD with the current medications that we have. Patients have relapses, medications don't work effectively, they still have episodes of extreme anxiety, depression. Patients have been suicidal despite being on medical therapy. So cannabis is an effective alternative. It completely helps with those symptoms.